13 signs of high blood pressure you're ignoring and what happens if you don't act. Have you ever woken up with that strange feeling of pressure in your head? That subtle throbbing behind your eyes that you brush off as just another stressful day ahead? Or maybe you've noticed those random nosebleeds that seem to come out of nowhere, but you blame it on the dry air in your home. I know exactly what it's like to dismiss these signals your body is desperately sending you. As someone who spent over 15 years helping people transform their cardiovascular health, I can tell you that high blood pressure is called the silent killer for a reason. It works quietly in the background, damaging your arteries, straining your heart, and setting you up for a health crisis that could have been prevented. The most frightening part? Nearly half of American adults have hypertension, and many have no idea they're walking around with a ticking time bomb in their chest. The traditional advice you hear is always the same, isn't it? Take your medications, cut out salt, lose some weight. But what if I told you there are 13 critical warning signs your body is giving you right now that could save your life if you knew how to recognize them? In today's video, I'm going to reveal these often overlooked symptoms of high blood pressure and exactly what happens inside your body when you ignore them. This isn't about scaring you. This is about empowering you with knowledge that most healthcare providers simply don't have time to explain during your 15-minute appointment. Imagine being able to recognize the early warning signs before they escalate into something serious. Imagine having the confidence to know exactly when you need to seek help instead of second-guessing yourself until it's too late. By the end of this video, you'll have a clear roadmap for identifying hypertension symptoms that most people miss, and you'll understand exactly how to respond to each one. So stay with me until the end, because this could be the most important information you learn this year for protecting your heart and extending your life. Before we dive in, I'd love to know if you or someone close to you has experienced any unusual symptoms that might be related to blood pressure issues. Drop a comment below sharing your experience, and let's start this important conversation. And if you're new here, hit that subscribe button and notification bell so you don't miss our weekly videos on natural approaches to cardiovascular health that most doctors never talk about. Let's start with the most commonly missed sign of high blood pressure: headaches that seem to target the back of your head. You know that dull, persistent ache that settles right at the base of your skull, especially in the morning? That's not just any headache. When your blood pressure rises, it creates increased pressure on the blood vessels in your brain. These occipital headaches are actually one of the most reliable indicators of hypertension, but most people simply pop a pain reliever and move on with their day. What's happening inside your body is that the excess pressure is forcing your blood against vessel walls that weren't designed to handle that kind of strain. Each time you ignore this symptom and mask it with medication, you're allowing that damage to continue unchecked. Over time, this can lead to weakened blood vessels in the brain, setting the stage for potentially life-threatening conditions like stroke or aneurysm. I remember working with Michael, a 52-year-old construction manager who had been treating these morning headaches with over-the-counter pain relievers for nearly 2 years. He only came to me after his brother had a stroke, which scared him enough to start looking at his own health more seriously. When we checked his blood pressure, it was 178/95, dangerously high levels that had likely been elevated for years while he ignored what his body was trying to tell him. The second warning sign that most people completely miss is unexplained fatigue that doesn't improve with rest. This isn't the normal tiredness after a busy day or poor sleep. This is that bone-deep exhaustion that makes even simple tasks feel overwhelming. When your blood pressure is elevated, your heart has to work significantly harder to pump blood throughout your body. Think of it like running your car engine at high RPMs all the time. It's going to wear out faster and use more fuel. That's exactly what's happening to your heart. This extra workload means your organs and tissues aren't receiving optimal blood flow and oxygen, leaving you feeling constantly drained. The frightening reality is that this fatigue is actually your body trying to conserve energy because it's in a state of chronic stress. Your heart is working overtime, sometimes pumping against pressure that's 50% higher than it should be, day and night without a break.
That's why no amount of extra sleep seems to help, because the problem isn't that you need more rest, it's that your cardiovascular system needs relief from the constant strain. The third sign is changes in your vision that come and go. Maybe you've noticed brief moments where your vision blurs, or you see floating spots, or even experience temporary vision changes that resolve on their own. Most people attribute these to eye strain from too much screen time or the need for new glasses. But these visual disturbances are often directly connected to how high blood pressure affects the delicate blood vessels in your eyes. Hypertension can damage the retina's blood vessels, a condition called hypertensive retinopathy. In its early stages, you might not notice any symptoms, but as it progresses, these visual disturbances become more frequent. The truly alarming part is that by the time you're experiencing these symptoms, damage has already begun. The tiny, delicate blood vessels in your eyes are actually providing you with a visible warning about what's happening to all the vessels in your body, including those in your heart, kidneys, and brain. The eye is the only place in your body where we can directly observe blood vessels without invasive procedures, which is why regular eye exams are so crucial for catching hypertension early. I want to take a moment to ask you something important. When was the last time someone truly listened to your concerns about these mysterious symptoms you've been experiencing? Not just checking your numbers during a rushed office visit, but actually taking the time to understand how these symptoms are affecting your daily life and peace of mind. So many of my clients tell me they felt dismissed by healthcare providers when mentioning symptoms like fatigue or headaches, often being told it's just stress or age. If this resonates with you, I'd really appreciate hearing your experience in the comments below. Something as simple as, "I've been experiencing morning headaches for 2 years, and my biggest worry is that it might be something serious." Sharing your story not only helps me create more relevant content for you, but it also shows others watching that they're not alone in their experiences. Sometimes knowing someone else is going through the same thing brings tremendous relief. And who knows, your comment might be exactly what someone else needs to read today to finally take their symptoms seriously. Now, let's continue our conversation about these warning signs that could be saving your life if you know how to recognize them. The fourth sign of hypertension that often gets overlooked is irregular heartbeats or palpitations. That fluttering sensation in your chest, the feeling that your heart skipped a beat, or suddenly racing heart rate that comes out of nowhere. These aren't just anxiety symptoms as many people assume. When your blood pressure is consistently high, it can cause your heart's electrical system to malfunction intermittently, leading to these irregular rhythms. Your heart's natural pacemaker relies on a delicate electrical system to coordinate contractions, but high blood pressure can disrupt this system in several ways. First, it forces your heart to work harder, which over time leads to thickening of the heart muscle, particularly in the left ventricle. This thickened muscle can disrupt the normal electrical pathways. Second, hypertension can cause small areas of damage throughout the heart tissue where electrical signals don't conduct properly. These areas of dysfunction can become sources of irregular beats. What makes this particularly dangerous is that these palpitations may be inconsistent, happening just occasionally at first, making them easy to dismiss. But each occurrence is a warning that your heart's function is being compromised, potentially setting the stage for more serious arrhythmias like atrial fibrillation, which significantly increases your stroke risk.
The fifth sign is nosebleeds that seem to come without any obvious cause. Many people attribute random nosebleeds to dry air, allergies, or just being prone to them. But when your blood pressure is significantly elevated, it puts extra pressure on the delicate blood vessels in your nasal passages, which can rupture more easily. These aren't your typical nosebleeds that stop after a few minutes with gentle pressure. Hypertension-related nosebleeds tend to be more severe, harder to stop, and may occur more frequently than you'd expect, especially if you have no history of regular nosebleeds. The mechanism is straightforward but concerning. The increased pressure in your circulatory system is literally forcing your blood against vessel walls with so much force that the smallest, most fragile vessels, like those in your nose, can't withstand the pressure and begin to leak or burst. This same process is happening throughout your body, just not in places where you can see the bleeding. Think about what that means for the blood vessels in critical organs like your kidneys, brain, and eyes.
They're experiencing that same pressure and potential damage, just without the visible bleeding that would alarm you. The sixth warning sign is that unrelenting ringing or buzzing in your ears, medically known as tinnitus. While tinnitus can have many causes, persistent high blood pressure is often overlooked as a potential culprit. The connection lies in how hypertension affects blood flow to your inner ear. The delicate hair cells in your inner ear that transmit sound signals to your brain require a precise blood supply to function properly. When your blood pressure is elevated, it can damage these tiny blood vessels, creating turbulent blood flow that you perceive as ringing, buzzing, or whooshing sounds. What's particularly concerning is that this same process of blood vessel damage is occurring throughout your body, potentially affecting your hearing permanently while also indicating broader cardiovascular risk. Many people live with tinnitus for years, trying various remedies without ever addressing the underlying blood pressure issue that might be causing or worsening it. In fact, studies have shown that people with tinnitus are more likely to have hypertension than those without these ear symptoms, making it an important warning sign that shouldn't be ignored. The seventh sign is a surprising one that few people connect with blood pressure: unexplained digestive issues. Those bouts of nausea, stomach discomfort, or changes in your digestion that medical tests can't seem to explain might actually be related to your cardiovascular system. Here's why. Your digestive organs require a rich supply of blood to function properly. When you have hypertension, the blood vessels supplying your digestive system can become narrowed and damaged over time, reducing blood flow to these critical organs. This reduced blood flow can manifest as digestive symptoms that seem to have no clear cause. Additionally, many blood pressure medications can cause digestive side effects, creating a confusing situation where the treatment itself might be causing additional symptoms. The deeper issue is that these digestive problems might be signaling reduced blood flow not just to your digestive system, but potentially to other vital organs as well. I worked with a client named Susan who had been to 3 different gastroenterologists for chronic digestive issues, undergone numerous tests, and tried several prescription medications with no improvement. It wasn't until we addressed her undiagnosed hypertension that her digestive symptoms began to resolve, demonstrating how interconnected our body systems truly are.
The eighth warning sign is frequent urination, particularly at night. Having to get up multiple times during the night to use the bathroom is often dismissed as a normal part of aging or blamed on drinking too much water before bed. However, this could actually be your kidneys signaling that they're under strain from high blood pressure. Your kidneys filter your blood, removing waste and excess fluid, but they require healthy blood vessels to function properly. Hypertension damages these small blood vessels in the kidneys, affecting their filtering ability. As a protective measure, your kidneys may try to eliminate more fluid to reduce the volume of blood they need to filter, resulting in more frequent urination. This is especially noticeable at night when you're lying down and your body redistributes fluid that may have pooled in your legs during the day. What makes this particularly concerning is that by the time you notice this symptom, kidney damage may already be occurring. Hypertension is one of the leading causes of kidney failure in the United States, yet many people never connect their increased nighttime bathroom trips with their cardiovascular health. Regular blood pressure monitoring becomes even more critical if you've noticed this change in your urination patterns. The ninth sign of hypertension is unexplained anxiety or a sense of impending doom that seems to come out of nowhere. Many people experiencing these feelings assume they're purely psychological and may even seek therapy or anxiety medication without considering that their body might be physically responding to dangerously high blood pressure. When your blood pressure spikes significantly, it can trigger your body's stress response system, flooding your system with stress hormones like adrenaline and cortisol. These hormones create those feelings of anxiety, nervousness, and dread. It's actually a protective mechanism, your body trying to alert you that something is seriously wrong. The particularly dangerous aspect of this symptom is that it creates a vicious cycle. The anxiety triggers your stress response, which further elevates your blood pressure, which then intensifies the feelings of anxiety. Breaking this cycle requires recognizing that these feelings might have a physical cause that needs addressing.
I've worked with numerous clients who were prescribed anti-anxiety medications when what they really needed was proper blood pressure management. Once their hypertension was under control, many found their unexplained anxiety diminished significantly or disappeared entirely. The 10th warning sign is facial flushing that occurs without obvious triggers like exercise, alcohol, or spicy foods. That sudden warmth and redness in your face, particularly your cheeks, might actually be your body signaling a dangerous spike in blood pressure. When your blood pressure rises significantly, it can cause the blood vessels in your face to dilate, creating that characteristic flushed appearance. This isn't just a cosmetic concern. This visible change is showing you exactly what's happening to blood vessels throughout your body during these pressure spikes. The dilation is actually a protective response, an attempt to reduce resistance and lower the pressure in your circulatory system. However, these repeated episodes of extreme pressure can eventually damage vessel walls, making them less elastic and less able to accommodate changes in blood flow. This reduced elasticity then contributes to chronically elevated blood pressure, creating a dangerous feedback loop. What makes this symptom particularly valuable is that it's visible, unlike many other hypertension warning signs. If you've noticed these episodes of facial flushing, especially if they coincide with headaches or feelings of anxiety, consider it an important signal to check your blood pressure.
The 11th sign is often completely overlooked: decreased exercise tolerance or becoming winded more easily than you used to. Many people attribute this to simply being out of shape, gaining weight, or aging. However, this could actually be a critical warning sign that your heart is struggling with the increased workload caused by hypertension. When your blood pressure is elevated, your heart must work harder with each beat to push blood through narrowed, resistant blood vessels. Over time, this extra workload can cause your heart muscle to thicken, a condition called left ventricular hypertrophy. While this thickening initially helps your heart pump more forcefully, it eventually makes your heart less efficient at filling with blood and responding to the increased demands of exercise. The concerning progression is that as this condition worsens, you may find yourself becoming short of breath with less and less activity, eventually experiencing breathlessness even at rest if left untreated. This symptom is particularly important because it directly reflects how well your heart is functioning under the strain of hypertension. If you've noticed that activities that were once easy now leave you winded, don't simply attribute it to getting older. This could be one of the most important warnings your body is giving you that your cardiovascular system needs attention. The 12th sign is cognitive changes like forgetfulness, difficulty concentrating, or mental fogginess. These symptoms are frequently attributed to stress, lack of sleep, or normal aging, but they may actually be directly connected to how high blood pressure affects your brain. Your brain is extraordinarily demanding in terms of blood supply, requiring about 20% of your body's total blood flow despite making up only about 2% of your body weight. When hypertension damages the small blood vessels that supply your brain, it can reduce blood flow to critical areas involved in memory, concentration, and other cognitive functions. Research has shown that chronic hypertension accelerates brain aging and is a major risk factor for vascular dementia and Alzheimer's disease. What makes this particularly alarming is that these cognitive changes often develop so gradually that you might not notice them until significant damage has already occurred. Every time you brush off that moment of forgetfulness or difficulty focusing as just being tired or stressed, you might be missing an important clue about your cardiovascular health. Regular blood pressure monitoring becomes even more essential if you've noticed any changes in your cognitive function, no matter how subtle. The 13th and final warning sign is perhaps the most overlooked of all: sleep disturbances that leave you feeling unrefreshed even after a full night's rest. Difficulties falling asleep, staying asleep, or waking up feeling tired are often attributed to stress, poor sleep habits, or other sleep disorders. However, these sleep issues can be both a cause and a consequence of hypertension, creating a dangerous cycle that's difficult to break without addressing the underlying blood pressure problem. Hypertension can disrupt your sleep in several ways.
The increased pressure in your blood vessels can cause micro-awakenings throughout the night that you may not even remember, but that prevent you from reaching the deeper, restorative stages of sleep. Additionally, hypertension is closely linked with sleep apnea, a condition where breathing repeatedly stops and starts during sleep, further fragmenting your rest. The relationship works in the other direction too. Poor sleep quality increases stress hormones in your body, which can elevate your blood pressure, creating a vicious cycle. What's particularly concerning is that nighttime is when your blood pressure should naturally dip by about 10–20%. If this nightly dipping doesn't occur, which is more common in people with sleep disturbances, it significantly increases your risk of heart attack, stroke, and kidney problems. If you've been struggling with sleep, despite trying typical remedies like limiting screen time or avoiding caffeine, it might be time to consider whether undiagnosed or poorly controlled hypertension could be playing a role.
The good news is that recognizing these warning signs early gives you the power to take control of your cardiovascular health before serious damage occurs. Here are the immediate steps you should take if you've identified with several of the symptoms we've discussed today. First, invest in a reliable home blood pressure monitor and start tracking your readings at the same times each day. Morning and evening measurements taken while seated quietly for 5 minutes beforehand will give you the most accurate picture of your cardiovascular health. Second, schedule a comprehensive checkup with your healthcare provider, bringing your blood pressure log with you. This data will be invaluable in determining whether you need medical intervention. Third, begin implementing the proven lifestyle modifications that can significantly lower your blood pressure naturally. These include adopting the DASH eating pattern rich in fruits, vegetables, and whole grains while limiting sodium. Engaging in regular physical activity, aiming for at least 150 minutes of moderate exercise weekly. Managing your stress through practices like meditation, deep breathing, or yoga. Limiting alcohol consumption to 1 drink daily for women and 2 for men, and achieving and maintaining a healthy weight, as even a 5 to 10 pound weight loss can significantly reduce blood pressure in overweight individuals. Remember, hypertension doesn't have to be a life sentence. With proper awareness, monitoring, and management, you can protect your heart and extend your life. I've seen countless clients transform their cardiovascular health and eliminate many of these warning signs through consistent, sustainable lifestyle changes combined with appropriate medical care when needed. Your body is remarkably resilient, and it's never too late to start giving it the care it deserves. If you've stayed with me until now, you probably know all too well the anxiety that comes with managing high blood pressure, the frustration of medications with side effects, and the feeling that you're fighting an invisible enemy. I want you to know that you're not alone on this journey. This channel was created specifically to build a supportive community for people like you who are seeking natural, effective approaches to cardiovascular health. Each week, we share new discoveries, simple recipes that naturally support healthy blood pressure, and answer questions that doctors rarely have time to address during brief appointments. If this information resonated with you, please consider subscribing to our channel and turning on notifications. This way, we can walk this health journey together, taking one step at a time without rushing, but with the consistency your heart deserves. I don't promise miracles, but I do guarantee honest information based on serious research and the experience of those who have achieved real results. Take care of yourself, and I hope to see you in the next video, where we'll continue our conversation about living better even with hypertension. Your heart thanks you for every small act of care you dedicate to it today.